welcome to Brighter Morning with Bhoe. We're so happy to have you this morning. We are on MCTV, Multicultural TV, and U97.5, Hot Like Pepper Radio, Multicultural Radio. This morning we have a very important guest, the Minister of Health, and we'll be talking to him this morning, Mr. Terrence Deyalsingh. And we also have Dr. Rebecca Gokul, who is president of the Shaw Foundation, and we'll be talking about action to support sustainable development in communities. We have an oil spill in Trinidad and Tobago. We're going to follow that, what is happening there. We're not sure what are the details of it, but that is something that we'd like to follow and look at. We have the Delta variant raging all over Asia and becoming an issue in China now, that is leading to the sacking of party officials and health personnel in China wherever clusters have emerged. China, of course, is a much more authoritarian system than we are. But the Delta variant is all over Asia as well, wreaking havoc. We have examples of how countries are dealing with the spread of this disease and the relationship between vaccinated and unvaccinated. In the US, we had a story on CNN this morning in which they highlighted many Republican politicians who advocated against vaccinations. Many of them had gotten sick and were lucky to recover, but some of them had gotten ill, infected by the variant, infected by the virus, and had succumbed and lost their life. In France, we have a situation in which it's becoming clear you have to have a pass indicating that you are vaccinated in order to go to restaurants, to go to train, in order to go into a bus, in order to do anything in which you are going to be with other people. And they have made their position very clear. There were protests there, but I think it has simmered down now, and more people in France are going to get the vaccine. We have the close of the Olympics. By all reports, the Olympics itself has been successful and heartwarming with a number of record-breaking performances. Trinidad and Tobago failed to get a medal, and that is causing some consternation on social media, and that is something that we might examine. And finally, I want to mention that the United Nations put out a massive climate change report yesterday and basically made it unequivocally clear that we are in a deep crisis in the world with regard to climate change, and a lot of the consequences of climate change that we are experiencing now are triggered by human action and intervention. And it is something I have no doubt that will generate a lot of discussion, a lot of controversy, and we need to keep that in mind. I think many people would have seen on the international news the fact that we have raging fires in California. You have the city of Athens in Greece almost threatened with being burnt down, and a lot of displacement of people because of this havoc. Climate change-induced forest fires. So we will talk about these things as the weeks unfold. These are important issues that are going to be with us for some time. We'll see if we get some kind of idea of what's going on with the oil spill here on the ocean just around Pointe-à-Pierre. So we will talk to Minister Terrence Deyalsingh now, and we welcome him to the show, Brighter Morning with Bhoe. Morning, Mr. Deyalsingh. How are you?
Good morning, Bhoe. Are you hearing me? I am fine, thank you.
Yes, we're hearing you loud and clear,
Lovely.
and that's good. I hope you're hearing me.
Yes.
We're going to have a good conversation this morning. We're going to talk about the health sector. We're going to talk about COVID. We're going to talk about what is likely to happen in the future. But before we get into that, there was just a news clip in which Representative Paré from Mayaro raised the issue of what constitutes the retail sector. And Saturday you had indicated, of course, that the retail sector would be open. Would you be in a position to clarify now, or do we need to wait on that?
No. Bhoe, I sent you a clip last night from the Chief Medical Officer from St. Lucia.
Yes.
You looked at it?
I listened to it.
You listened to it?
Yes.
And she is literally begging politicians to stop politicizing COVID. She was in literal tears. Good?
Yes.
And we need to follow the same pattern in Trinidad and Tobago. The UNC has sought at every turn to politicize COVID. This latest salvo by the UNC, what constitutes retail, and it didn't hear about casinos and didn't hear about hairdressers. It is so simple.
I think the big issue was bars, though.
What was it?
I think the issue you raised was whether bars constitute retail.
Right, good. So I'm coming to that.
Yeah.
Mm-hmm. So if you would just allow me to piggyback on Dr. Bobron, who was in tears asking politicians to stop politicizing COVID. If one simply reads the public health regulations, which is a legal document, there is a clear distinction, a year and a half now, of what is retail, what is bars, what is personal services. And it is there for all to see, Bhoe, in black and white. Why do we continue to politicize this issue when there is no need to? The public health regulations are very clear when it talks about retail, when it talks about bars separately. So, I am just like the Chief Medical Officer of St. Lucia, Dr. Bobron. People are just fed up in Trinidad of the politicizing of COVID.
Okay, well, let's not
go... COVID will attack UNC, PNM, independence with equal ferocity. Yeah, and the public health regulations, Bhoe, if one takes the time to read it, speaks about the distinction between retail, what is bars, and bars are clearly and have never been included under the rubric of retail.
Okay, so the retail sector, is classified under the Public Health Act, and that is what you meant by the retail.
The regulations, regulations.
And that is clear, and that there is to be no confusion between bars, which are separate and distinct under the
Exactly, Bhoe.
All right. Okay, so we clear that up, but let's not politicize the other side of it.
Thank you.
Good. Let's just deal with the issue, because we have a major health issue that is rampaging all over the world, and we are affected by it. And I will move on now to what I think has been one of the successes in the country, which is to say the collaborative relationship between private sector, government, and NGOs to make sure that the country is vaccinated. Would you like to tell us a little bit of how that has gone?
So thank you. So I think the name Nira Tiwari might mean something to you, Bhoe.
Yeah, he's my son.
I'm just teasing you, Bhoe. Okay, so from day one, we always knew that if we had to vaccinate people by the hundreds of thousands, that other sectors outside of the public health sector will have to get involved. The only way that could have been operationalized is if you had vaccines in large amounts. You had to have hundreds of thousands of vaccines. Once that became a reality with the purchase of 800,000 doses of Sinopharm vaccine, we kickstarted that initiative with the private sector. First of all, with the Supermarket Association, and let me congratulate my colleague there, Mr. Rajiv Dipti. Then we went to the Diwali Nagar with TTMA and so on, congratulate them. And then we rolled it out eventually to the other sites under the auspices of the Chambers of Commerce, AmCham, and all other private sector entities. It started off very, very well, very impressive. We were getting good numbers. But then as you see all around the world, the numbers started to dwindle. But the partnership is an excellent partnership, and it continues today with the rollout of the AstraZeneca doses. So I look forward to an uptick in numbers today, but that public-private partnership is an excellent model for us to use, and I am so proud of the way the private sector responded to the call.
All right, very good. But give us, we have the numbers, but just for the sake of public knowledge and repetition, could you tell us about how many people have now been fully vaccinated, how many people have gotten one dose, and what is your target by what date based on your current trajectory?
Sure, thanks. So to date, just under 420,000 persons would have gotten their first dose, which I believe corresponds to about 30% of the population. About 228, 230 persons have gotten their second dose. Now, second dose does not mean that you are automatically fully vaccinated. To be considered fully vaccinated, you have to have had your second dose, and then you wait 2 weeks for your immune system to build up enough immunity. So about 420,000 persons, 30% of the population, first dose, 230,000 people with their second dose. That Bhoe is a decent place to be, but by now we were hoping that 417 would have been closer to 500,000. But with the slowdown, we have to accept it's at 417, but we should have been closer to 500,000 by now. Herd immunity, which is the ideal, as you know, is about 70% of your population, which translates to about 900,000 adults, because unfortunately we can't vaccinate children as yet. So basically, Bhoe, we are just about, if you consider 900,000 people to be your ideal, which very few countries or any have reached.
Sound.
Yeah.
Okay.
Are you hearing me now?
Yeah, we're hearing you now. That's fine.
Yeah. So if 900,000 is your ideal, and for herd immunity, very few countries, if any, have reached that point. We are just under halfway there. So that is to tell the population where we are and to encourage the population to get more and more vaccinated.
Yeah, as a citizen minister who wants to see our country and our people protected, I would hope for a speedier, process by which we could get more people vaccinated. I am pro-vaccination, and I am not apologizing for that. I think it's the right and healthful thing to do, not just for yourself and your family, but for everybody else whom you meet. And this problem of the hesitancy that we are seeing now, how are we going to deal with that in order to speed up the number of, to increase the number of people and to speed up the process?
Okay, so let's draw a distinction, Bhoe. I have a slightly, I won't say disagreement. You mentioned the process, speed up the process. The process of getting vaccinated is not a problem.
Okay.
It's easy. You walk into any health center, without an appointment, you get vaccinated. You walk into any mass vaccination site, you get vaccinated. You drive through any of the 3 mass vac sites in Trinidad and 1 in Tobago, you get vaccinated. So the issue isn't the process. So let's make that distinction. The issue now is addressing what are the concerns people have at their individual level for not being vaccinated. Is it genuine vaccination hesitancy? Is it a fear of needles? Is it white coat syndrome? Do people want transport? These are all the issues we are grappling with right now and addressing them one by one. So let's take the issue of transport. We would have partnered with PTSC to provide transport because there are some people who want to be vaccinated, and under the classical definition of vaccine hesitancy, it means a delay in making that choice for a variety of reasons, one of which is transport. So we are addressing it from that perspective. We are talking to people literally one-on-one in communities now through the RHAs. Businesses are talking to their employees one-on-one with medical professionals to address what might be called true vaccine hesitancy. That is, in their mind, they have a fear, they don't have confidence in the vaccine. That is being tackled literally on the ground. You can't tackle that with one message on a radio ad or a TV ad. So there's a significant ground war now being led by the RHAs in their communities, talking to people literally one-on-one or in groups, and by the business sector, talking to the employees, employing doctors to answer their individual concerns. So that is what the country, the public sector and the private sector is doing now. Unfortunately, we're up against some very powerful forces, well-resourced by their religious headquarters out of the United States, well-resourced in US dollars, that have the capacity to buy newspaper time, airtime, influencing their members, quoting Corinthians and the sign of the beast, which in fertile minds, when that type of thing takes hold, it is difficult on platforms like these to address that. So we are fighting the vaccine hesitancy on all fronts. We have asked responsible religious leaders to come out. The Archbishop has come out. Reverend Berkeley from the Anglican Church has come out. Dharmacharya from Mahasabha have come out. The Islamic community have come out, and I congratulate them and thank them. Other voices have come out. You have come out, Bhoe, and I congratulate you on that. So the more people that could come out will also help in the fight.
So besides the general issues of vaccination hesitancy, which might have to do with fear or skepticism, yes, or medical suspicion and so on, you are saying that there is a kind of religion-based resistance, yes, that is organized and orchestrated. How are you going to, yes, deal with that? Are you going to try to deal with that, or are you going to try to get everybody else to go to the vaccination
right
site?
Now we are trying to deal with it on the ground, but these religious organizations, as I say, are very well organized and very well funded out of their headquarters in the United States. Very, very well funded. And the local voices that are part of this conspiracy have a lot of sway over their congregations.
I'm aware of that.
So we are not going to totally ignore them, but we are going to put several messages out, and we have already started. We have started doing a lot of work on radio. We had a good session on drive time on one of the radio stations on Friday, where we encourage people to talk to us one-on-one. We had 30 interventions on radio over June, July, with medical doctors going out talking about the issue of vaccine hesitancy. So it's a battle we continue to engage in, fighting for the hearts and minds of people.
On the news read by Chanel Alciran just prior to my coming on the program, the CMO was indicating what was happening in the country, and he indicated that there seemed to be a fairly high number, relatively high number compared to other places in central Trinidad. In your talking to me just now, you said that vaccinations are available in health centers. Does that mean that anybody in central Trinidad could go to the Diwali Nagar site and get a vaccination, but they can also go to the health centers near to them and get a vaccination or get vaccinated? And does that also apply across the country?
Yes, so thanks for that, Bhoe. So we opened up this situation for access once we got the 800,000 doses of Sinopharm vaccines. About 2 or 3 weeks now, access has been increased. You can walk in, you don't have to make an appointment, you don't have to go twice. You can walk into any health center, any of the mass vac sites, and be vaccinated. It is that simple. We have made it so simple. We have broken down every barrier that used to exist when we did not have large numbers. Now there is absolutely, Bhoe, no barrier to being vaccinated.
Okay.
And I'm glad you raised the issue. Those counties, County Caroni, County Victoria, have traditionally been counties where you saw a disproportionate amount of cases of COVID-19 in Trinidad and Tobago. And then they spread to others. So right now, the 4 areas we are concerned about are County Caroni, as usual, County Victoria, as usual, St. George East, and also Tobago. Those 4 areas, those 3 counties in Trinidad and Tobago, are those 4 areas that are currently driving the caseload that we have. I don't have disaggregated figures as to the vaccination rates in the counties, but we do know there are challenges in Tobago, and we just urge everybody that vaccinations are safe. A vaccinated person, you have a 99% chance of not becoming seriously ill. You have a 99% chance of not going into an ICU or HDU, and you have a 99% chance, Bhoe, of not dying from coronavirus. So the death rates and the death toll that we are seeing is now only amongst the unvaccinated. And the key message that we need to get out, and I'm so thankful for this opportunity you are giving me this morning, Bhoe. I'm so thankful for it and thankful for you for being an advocate for vaccination. The message is the unvaccinated individual stands a higher chance of dying from the virus, becoming seriously ill, whereas the unvaccinated individual stands a 99% chance of not dying, not succumbing, not going into ICU or HDU, and not getting seriously ill. And those are the international figures. And now as we vaccinate more and more, it is being reflected in our local figures, that all the deaths are occurring amongst the unvaccinated.
Okay, I'll get to that in a second, but I just want to make an appeal to the people in Tobago. You have 60,000 people in that small island, part of Trinidad and Tobago. And if we have vaccine hesitancy there and we do not vaccinate that population, it'll be very, very difficult to get your tourism and your rest of your economy that supports tourism going. I mean, it's really important to have the vaccination. In St. George East, I would make the same appeal We need, the East-West corridor, people are up and down in taxis everywhere. We've got to get people vaccinated. And in central Trinidad and in Victoria County, could we please go to the health centers, wherever is nearest to you, and get vaccinated? We need to vaccinate the population. You need to protect yourself, your children, the rest of your family, the older people in your community. And you need to be able to live ordinarily and without fear. So I would make that appeal. But let's get to this business of deaths now. One of the issues I think that have been troubling, and it has been troubling even to me, because I had a particular case which occurred that I was very familiar with, is the fact that a lot of people, it seems, I don't know what the facts are, but it seems like a lot of people who get into the ICU never really come out. And
wait, Bhoe, hold on. I don't want to scare the population. Once you reach an ICU, intensive care unit, it means you are very ill.
Yes, I know that.
So let's be careful. Let's be careful. Once you reach an ICU, it means you are very, very ill. Okay?
Okay, but you see, right. This is important. The people one has that impression that once you get into the ICU, it's very, very difficult to come out alive. And the second issue might be, do we wait too long to take people to the ICU? And is there something that we are doing there that we can do better that would reduce the number of deaths and protect more lives? And I give you the opportunity now to speak to that.
Okay. So I always defer these to the clinicians like Dr. Trotman, but I will talk to you in general terms. We have estimated that close to 20,000 persons have passed through the parallel healthcare system due to COVID. 20,000. Unfortunately, just over 1,000 have died, and our deepest condolences go out to them. So those are the raw numbers. 20,000 persons have passed through the parallel healthcare system. Just over 1,000 persons have died. You are asking about death. Dr. Hines and Dr. Trotman and the CMO have been at pains to explain to the country that our case fatality ratio is in keeping with international norms. Many countries are significantly higher than us. So from a purely statistical perspective, which is of no comfort to the families that have lost loved ones, from a purely statistical perspective, Trinidad and Tobago is either below or at the global average. Good. So 20,000 persons have passed through the parallel healthcare system. Just over 1,000 persons have died. We are either within or slightly below the global average for case fatality ratio. Then you made the point, are people taking too long to get into ICU? The decision to put somebody into an ICU is the one made by the clinicians, and they will do it on the clinical signs and symptoms of the patient facing them at that time. So it's not a matter of being too late to take you into an ICU. Another issue that we have to face up to, and Bhoe, you would remember when you were in the Parliament, the first 3 years of my being Minister of Health, we kept talking about NCDs and Trinidad and Tobago and diabetes and hypertension. Trinidad and Tobago is the diabetes capital, if of not the world, but we are a highly unhealthy population due to diabetes, hypertension, high cholesterol, and so on. And the case fatality ratios will always be higher in countries that have a higher burden of diabetes. So you have to take all of these things into consideration when we make pronouncements about the death rates.
Yeah,
So I
well,
hope that brings some clarity to the issue.
well, it's important for you to address the issue and to
Yes.
explain the position, because a lot of the deaths that take place are announced with the corresponding qualification of comorbidities,
That's right,
etc.
yeah.
So I will get to that in a minute, but I want to ask you something. I want to take you back a little bit, and I don't want to spend a long time on this because it's past.
Sure.
It's already over. But I want to ask, I mean, given from the inception your management of COVID, I mean, clearly along the way, some positive steps have been taken. I myself can articulate some. And certainly there have been mistakes and setbacks that have taken place. Can you talk a little bit about that without going into a long explanation? Let's just spend a minute or so on that, a minute and a half maybe, on how this situation have been managed and where we are now in terms of, let's say, getting on top of things. And let's be straightforward with the population that, look, everything didn't go perfectly, but we are where we are, and let's make the best of where we are going forward.
Thanks. So one of the critical things is that the Honourable Prime Minister always believed in his science from day one. And he led the response based on science. One of the best decisions we made was to operationalize the parallel healthcare system so that your traditional healthcare system did not collapse, was not affected.
I think that,
right?
That was a good decision.
That was an excellent decision that we made, and our normal healthcare system continues to run. Women are given birth. Our maternal mortality rates are still very good. Our infant mortality rates are still very good. Our major medical equipment is up. So a lot of good things are happening. I think the major error, and I take full responsibility for it, in a year and a half of managing this, was the call to go out maybe a month and a half ago to be vaccinated. That was an error. That was my major error in a year and a half of managing this. I made the necessary apologies. I fell on my sword for that, and we made the necessary corrections. What the population doesn't understand, you see, when you go behind the scenes, this is not only the parallel healthcare system. It is operationalizing facilities like DB, UTT in Valsane, where you take persons who just need oxygen alone, so you don't clog up Couva, Arima, Point Fortin. That was a major development. And those weren't hospitals. Those were dormitories that we operationalized to set up things like oxygen bars, because we learned from the experience of India, where people were dying in India just because they could not get oxygen. So we looked at that and said, what could we do to mitigate that risk? What could we do to ease up the parallel hospital system? So we set up oxygen bars in UTT Valsane, All Area Hospital Point Fortin, and DB. And Bhoe, that was another brilliant decision that we made in conjunction with the parallel healthcare system. So those were the lessons learned, those were the successes, that was the major error, and here we are now. But where we are now, Bhoe, is that now we have vaccinations that we didn't have 6 months ago.
Yes, that is true.
Right?
That is true. We're in a better position because we have the vaccinations to administer, and what we need now is the receptivity of the population to get vaccinated.
Well said, Bhoe.
So, all right, but tell me something. Has there, in spite of the system that was created outside of the regular health system as a parallel, there was an instance when we were very scared that the parallel health system would be overwhelmed and that things might well spill over into the hospital. We were able to get past that. And there still is a feeling, though, that maybe COVID has so taken the resources of the health system from the public sector that the hospital system itself has suffered as a consequence. And therefore, the regular needs of patients, apart from COVID, are not as well attended to as they need to by the public health system. Is that true or not? And what is the reality of that situation?
Yeah. So the reality is not because of resources. Whenever you are dealing with an epidemic in a public health system, and resources are limited, especially personnel, you have to rationalize and deploy resources where they are needed. So your basic health provision at the regular health system goes on unabated. Where the population may suffer some discomfort and have been are what we call non-essential services. So like elective surgeries, yes, that has been an issue, as you would expect, because you need to divert nurses, you need to divert doctors now to your parallel healthcare system to administer vaccines. So we are attempting to do and have been doing the emergency electives. Your outpatient clinics, where you don't want people congregating, we have had to switch to a model of telemedicine instead of coming in personally and refilling prescriptions. Now, that is not ideal, but it's what you have to do in a pandemic. So, Bhoe, it's not because of resources, it's born out of necessity, how you manage people coming into your health centers, coming into your hospitals, mitigating risk, giving them some basic level of service at that level, at the outpatient level and at the elective surgery level. But services like maternity care, baby delivery have gone on regardless. Major surgeries gone on regardless. Accident and emergencies gone on regardless. So there will always be some level of discomfort in a pandemic when you have the same number of doctors, the same number of nurses, because as Dr. Mariam Richards will always say, a bed is not a bed. A bed needs people around it, doctors, nurses, radiologists, and these are not, we don't, because you have a pandemic, there aren't double the amount just waiting there to be hired. There aren't double the amount of radiologists. There aren't double the amount of anesthesiologists. So in a pandemic, you do have to rationalize, right?
What about vaccination in the health sector, the public health sector? Is everybody in the health sector who are attended to patients of any kind, are they all vaccinated? And if not, how are you going to deal with that?
Short answer is no. The distinction I made on Saturday amongst companies where your executive team, your supervisory team, your managerial team tend to be over 90% vaccinated. And as you come down to the shop floor level, the levels of vaccinations drop. You have the same pattern in the health sector. At the level of the doctors, over 95% of doctors are vaccinated. But when we come to nurses, it tends to drop to 40, 50%. And all the RHAs are working tirelessly, talking to nurses either in groups, ward by ward, individually, lab workers, patient care escorts, all the non-doctoral staff. We are giving them the information and asking them that it is in their own best interest to be vaccinated. And we continue to do that because we love these people too much. They have been at the forefront of this. When the Delta, not if, when the Delta variant is discovered in Trinidad and Tobago, we don't want our healthcare workers either to get it in the communities where they live and bring it into the hospital system, or get it in the hospital system and take it home to their families.
Yes,
we consider our healthcare workers to be a cherished resource, and we will be working tirelessly with them as a group or individually to get vaccinated. At least we may not get them up to the 90-95% that the doctors are, but we will be comfortable if we could get them up to about 70%. Right now, we are about 40-50%.
Would you at some point insist that all health workers be vaccinated? I mean, it's for their own,
no, that is a bigger...
They have done human service to the country,
yes.
and we recognize that. But I mean, it's a danger to themselves and to others.
Yes.
And they are in
yes.
the health sector. They should set an example.
Yes. So right now, the strategy is to use information, dialogue, listen to their concerns, address their concerns either collectively or individually, persuade them, encourage them, moral suasion, lead them to the well, make it easy, give them all the information that they want. But there is no move afoot at the Ministry of Health now to make it mandatory, but it is highly, highly recommended for their own safety, for the safety of their patients and their families, because the unvaccinated healthcare worker will take it home to their families. They use public transport. They are part of a wider community.
I only have a few seconds left before the news, Minister, and I'm going to ask you one question, and if you could answer very quickly. Are we prepared for the variant that will inevitably come here? Are we prepared, and are we preparing to manage in that situation? And will we speed up the vaccinations so that we could be in a better position?
Well, that is what we are doing now with the vaccinations. So we urge people to get vaccinated. At the hospital level, we are doubling the ICU capacity because with the Delta variant, you're going to need a lot of ICU capacity. But Bhoe, if the population doesn't heed the warning that we have been given about the Delta variant, we can do all we want to create space and beds, but that is finite. If the Delta variant really gets hold amongst the unvaccinated population, the population is going to be in a very bad place. Because a bed is not a bed.
All right, Minister. I want to thank you very much for coming in this morning and for basically having a serious conversation about the health sector, the COVID vaccine, and where we are headed. I hope, with the help of God, that we are able to control this thing and manage it here. It has gotten out of hand in many other countries. We don't want that to happen here. We care about our population. We don't want to see a lot of people dying in Trinidad and Tobago. It's not going to be nice. And I want to thank you for coming and having a honest conversation this morning on the issues related to the health sector. Thank you very much. We'll talk another time.
Thank you very much, Bhoe, and good morning, and just get vaccinated.
All right. We move on now to Chanel Alciran and the news.